Today we have very special guests, Dr. Ali Azamov and Dr. Mohsin Shah.
People say, this is a good doctor. That's success.
If you're afraid, don't do it. If you do it, don't be afraid.
So you started from one thing and you ended up in completely the opposite thing.
You're still entitled and in a position to deliver the message.
In 2-3 days, like, you're gonna die. I don't know when you're gonna die, but you're gonna die.
But you have to pick your moment, I think.
There's a lot that we help and there's a lot that sometimes we can't help.
Do you ever feel like scared?
Please don't tell my mother she has brain cancer.
Hello guys, and welcome to the second episode of CAU Podcast. And today we have very special guests, Dr. Ali Azamov and Dr. Mohsin Shah. We'll talk about the neurosurgery and general medicine, and we'll see their pathway to the special and difficult profession. Hello.
Hello, thanks for having us.
First of all, I would like to thank you for coming today to our podcast, and thank you for finding time. We really appreciate as a university, and from the face of our university, we'd like to thank you. So can you please introduce yourself and tell us about your background?
Hi, my name is Ali Azamov. Ali Sharhan Azamov, full version. I was born in Uzbekistan back in 1974, and 1991 I was entered to medical school here. In Uzbekistan, 97 I complete medical school. I start my residency in the surgery, first year, second year doing neurosurgery. And then I got invited by Department of State to 1-year fellowship, internship overseas in the United States, actually at UC Davis. And I stayed there for 27 years, and up and staying there for 27 years.
That's quite a lot, right?
Yeah, complete all training, residency, fellowships, and stuff like that. And unfortunately, I didn't become a neurosurgeon. I became a neurophysiologist, which helps neurosurgeons to go through the procedure. Eye of the surgeon deep in the tissue. So we basically navigation system for neurosurgeons, spine surgeons, and help them to go through the procedure. Our ultimate goal is to make sure we're not causing more problems than it is now with the patients, and make sure patient will wake up and move all 4 extremities as he or she go before. Or she was before.
Yeah, you have a quite big role actually in the surgery room.
Thank you. Not as big as Dr. Shah's.
It's a teamwork, though.
Teamwork.
Yeah, but I guess like every person in the surgery room plays a big role because at the end of the day, it's a teamwork.
True.
So, yeah.
True. And patient care.
Yeah.
Patient care is number 1 priority always, supposedly. Yeah, that's a little brief. And since 2016, I started coming to Uzbekistan for missionary medical trips. And we did like about 25 surgical cases with multiple physicians throughout the United States, St. Louis University Medical School from UCSD. It's University of California, San Diego Medical School, WashU, Washington University Medical School. It's been quite a journey, and we did very interesting cases here and with the local physicians too. And we actually impressed by the skills of local physicians, how they operated and how they performed their job and their duty with that kind of equipment and that kind of setup as they have now, specifically in the government hospitals. It's like unbelievably impressive in a good way. Yeah.
That's actually really nice to hear from you, because if you take a look at our government hospitals, well, it's obviously not that organized as the private clinics. And to hear that they handle their work properly in the governments, it's really impressive. And you?
So my name is Dr. Mohsin Shah, or a lot of people will say Mohsin Shah. And I'm ethnically from Pakistan. I was born in Toronto, Canada, but raised in Canada through my first elementary school and then later in the United States. And, I went through a lot of indecisions, I would say, about what I was going to do. Typical in the United States, a lot of people don't necessarily have specific focuses that they would, what they're going to do with their lives, what are they interested in or so. So initially I wanted to become a aerospace engineer, and because I loved planes when I was a child. But at that time, the war with the Soviet Union collapsed, and then all of a sudden we found a lot of engineers out of jobs. And so then I would think, well, that's not a lot of job security. What am I going to do? And then I decided, well, maybe medicine would offer something better. But I didn't have the plans to become a neurosurgeon yet. And then I went through medical school. Neurosciences at that time was something that piqued my interest. And I initially went into neurology, which is the practice of as a neurophysician. And they deal with certain sets of neurological disorders. But the reason for neurology was I was interested in stroke because at that time they had some actual treatments available for stroke, which is the medication they give so that they can, a clot buster. Previously, there was no treatment for stroke. So if you had a stroke patient, you couldn't do anything. And then all of a sudden, now you have a medicine that you could actually give if you give it early enough. It could reverse the effects of a stroke. So that was very cool for me. And I went into there. But then, one of the nicest things in neuroscience is there's so much advancements that was happening so quickly, not just for medicines, but then for interventions and surgical, minimally invasive surgeries. And all this was exploding in the late 90s and 2000s. And I went from neurology to then into neurosurgery and then doing what's called endovascular neurosurgery, which is doing catheter work through, the veins and the arteries to fix brain aneurysms and, try to take care of strokes and a lot of other disorders. And I also then went into more fellowships as well. So my journey is a little unique. Most people just decide to do either neurology or neurosurgery or and maybe do a fellowship. I went to neurology and neurosurgery and multiple fellowships. And mainly because I would encounter one set of problems and, being the perfectionist I am, I wanted to say, no, we have to now try to fix this problem. And so I had to, gain more knowledge in it and decide to do another field and specialty in that field as well. So now I am considered, a multi-specialist neurosurgeon. And I take pride in taking care of the sickest of the sick neurologic patients, people with bad traumatic brain injuries, strokes, bad spine problems. So, the worse the problem, the more, I enjoy treating and I get a lot of satisfaction. A lot of hard work, extremely hard work, but also very satisfying to me as well. So that's, my brief. And how I came here is through Ali that I met in the United States. And I'm generally been very eager to follow global health. We have missions to Thailand, to Malaysia, to Indonesia. And of course, when Ali asked me about the opportunity here, I was the first one to get on the bandwagon because I really see now with the technological advancements, I see the youth, especially like you, know everything that's going on in the world. And the doctors now know everything that's going on in the world, what we're doing or so. So it's a really cool time to be able to collaborate and exchange our ideas and exchange our knowledge so that, patients over here can benefit from what we know and how we do things or whatnot. So it's an extraordinary time. And as much as, there are also wars or so, but I think the youth, you guys are going to be the ones that set the agenda, because you're connected, you're open-minded, you're hungry, and it's really cool to see, whether it's in business and sciences or so. So it's really cool to see that, and I'd love to be a part to help foster that. So that's my story.
That's a lovely story, to be honest. You're really like challenging person, as I see, right? Like, I guess it's because I'm a medical student too. And I did the same thing. Like, if they told me to practice in one department, I would better try all of them and see what I like more, rather than I spend my time in one department. Because, the more I get to know, everything I learn will be left for me. So I really liked your story. And that's really cool that you travel the world because of your profession, and you enjoy your work, and you're hungry for your work, and you do like exactly what you want to do. And it's pretty cool if you achieve at the end what you wanted to achieve. I guess the second question will be more into neurosurgery, because as we all know, it's a pretty difficult profession. It's a very stressful work and takes a lot of time and patience. And it's like detailed work, It's at the end of the day, it's a human's brain, and has a lot of details and stuff. So I wanted to ask you, why exactly neurosurgery? Like, what brought you there?
Right. Well, I'm going to talk both as a neurologist and a neurosurgeon, because I think, we shouldn't just, although neurosurgery gets the most, you could say, attention, it's the more glorified of the fields. But there's a lot of, opportunity in neurology too. I straddle both. I practice actually a lot of times in my neurosurgical practice. I use my neurological background too, and they're very interchangeable in certain respects. So, rather than just focusing on neurosurgery, I'd like to go between both, because I think people need to recognize there are huge opportunities in both these fields, probably even more so in neurology, because beforehand there were, we're talking about now disorders that we're never being able to treat: Alzheimer's, dementia, Parkinson's. These were things that, you would just let go. And now we actually have, medications and therapeutics and stimulators and stem cells and all these, which is really cool. You're talking about disorders that you could never treat. Of course, there are other aspects in which neurosurgical interventions are really needed or so. And of course, that has its own unique set of, requirements and, and discoveries that, still have to be made, technological, a lot of them or so. But, I think we both benefit from the science of learning from one, one field to another. But as far as specifically what neurosurgery kind of attracted me, there's two things. Number one, I believe I have good hands, because as a child, I was always an artist. As a matter of fact, I was in the gifted program for visual arts in Canada. So I was always an artist from that, using my hands. But of course, in childhood, I would draw like cars and airplanes, and that's why I wanted to become an aerospace engineer. And, in fact, a funny story, I used to draw these, I had a whole portfolio of drawings. And when I moved to the United States, I gave my cousin, that portfolio. And later, 10 years later, I found out that he actually entered a few in a contest, and he won money off of it.
Wow, that's good.
And he put his own name on.
Where's your royalty?
Exactly.
He's a businessman.
Exactly. So needless to say, I had a few words for him too. But anyways, I always loved the arts as well, and I thought I was good with my hands, but I never really knew, how intricate, hand-eye coordination and, your skill set, your dexterity set would actually be useful in like neurosurgical, field. But on top of that, also technology. I love technology. I love, all the advances in technology, in computers and robotics, and, that's always something that attracted me. So we're going in the future with these technologies as well. So both those, and neurosurgery is very tech dependent. The tumors that we take out, or the surgeries that we do now, we have navigation systems. And these navigation systems get a lot much more sophisticated and allow us to do things, in such a, extraordinary detail and accuracy. That's really cool. These are things that, people even 10 years ago weren't able to do, and now we're able to do. So both those facets probably, excited me more and gravitated me towards, the neurosurgical fields. But I have to say, though, how things change. When I first, I considered both neurology and neurosurgery in the beginning. This is back in the, mid 90s. And I saw my first neurosurgical case, and it was a huge disappointment. So sometimes, the way things turn out, it was a brain tumor, and all I saw was, this surgeon that was struggling with just bleeding, and that's all. I couldn't even see the brain. It was just bleeding and bleeding and bleeding, and it was like 6 hours of just bleeding. And,
you were a student at that time.
Yeah, I was a medical student, and I went out and I said, "Boy, that was a disappointment." I mean, that was just blood. I mean, I didn't see the brain or anything. But I said, well, maybe it was just that one case. So the second day I went in and I saw a spine case. And then that spine case was like 8 hours, and, the assistant, the resident wasn't there. And so I had to chip in and, hold the retractor for hours and getting tired. And, and that was a disappointment too.
So when did the disappointment end?
So
which surgery?
That's what I was saying. Sometimes you don't know. And that was traditional surgery, but, and that's why I did neurology. And then after, about 6 or 7 years of training and, as advancements came in, well, then I actually saw brain tumors that were being, done very meticulously with accuracy using the navigation systems. And then, spine surgery now being performed with, navigation systems to put this, the instrumentation and perfect alignment and, a lot less blood loss and all these technologies that came in together to make, these procedures a lot much more cleaner, safer, quicker, which I didn't have, when I first began. So it's very interesting how sometimes you don't intend, but then, things may change in a way that then it retracts you. So I would say, yes, it's important to keep goals. If there's a specific field, we have to choose a field, because we can't accomplish everything.
Right.
But choose a field, but always keep an open mind. Always keep your plans adaptable. Keep, if the need comes, either because you have a separate interest or, there may be a discovery or a new way of doing things in a certain field that you never thought about. Just have an open mind and, always go for it because
see where it takes you.
Exactly. Or so. And one thing I would advise anybody, in this field is never think that, it's too long because life's a journey anyway, right? It's more important to invest your time and the effort and either get more education or more training or more skills or whatever it takes. Don't worry about, I need to do this quick as I said, I was, when I entered residency after medical school, I was one of the youngest residents to come out. And then by the time I was done, I was the oldest resident to come out. But when I look back, each and every time was worth it. And now I get much more satisfaction at the skills that I have.
Yeah,
and
knowledge skills.
Exactly. So that's an investment for you. So, anybody, watching this, I would say, whatever your goals are, don't compromise on the time or the effort or so. When you see it, put that effort in there, put that investment in time. Training, education, knowledge can never be, wasted, so that would be my biggest advice.
That there's a quote that they say, like, it's better to go and try it rather than don't try it and then regret that you didn't try it.
Absolutely. Yeah.
So that's really interesting, actually, because you started from one thing and you ended up in completely the opposite thing. Like, it shows how life crazy is, and like you never know what will happen to you in a few years.
That's true. And that's life's journey, right?
Yeah.
And it takes us places. I never thought I'd be here in Uzbekistan.
Same me. I never thought I would take a podcast with you.
But, these are the things that, give, excitement to life and joy and, happiness knowing that what we're doing, is affecting others, and also the world that is, again, growing and becoming more interconnected. So every time people becomes too pessimistic about, their times, or, the economies or the wars or whatnot. Yeah, there are disappointments, absolutely. But I think there is much more to look forward.
Yeah, exactly. I agree with you. And what about you? Why exactly medicine?
Why exactly medicine? Because I came from the family. My grandpa was a doctor, then my auntie, my cousin's doctor, and I always dreaming to become a doctor. And again, I was good with the hands too and arts. And I think it's you have to be kind of like creative in order to become a doctor. I mean, it's always plus, I would say, yeah. And and I always like to help people. I always like to help people, and I always like to see the satisfaction on the patient side, and seeing them satisfied, being healed, and that makes me happy, and makes my work more enjoyable for me. And I'd like to do that. And I have zero regrets that I pick this, even though I come home like after long day and stuff like that. And when my kids asking me like 10,000 questions and I don't want to answer that. But at the end of the day, I feel so, success, great success, after like long day, and you're analyzing your day and which patient get what and get help, get cured. Sometimes it's sad stories because you cannot help, and they asking you or they waiting to be helped by you, but you can't. We can only help you to go through or kind of like be next to you, but it's everything in hands of Allah, and He is the best planner, and He is the one who determines your, either you cure or not cure, it's your time yet or not, and stuff like that. And another point why I picked medicine is I think out of all discipline, medicine is the more humanitarian, more you help one person and God gives you, something in exchange, let's say, for 10 times more, and that kind of feeling is unbeatable.
You actually, both of you, like by your stories, you motivated me to study more, because I'm a second year now and I still have a long journey in front of me. And that's really like, how to say, motivating to hear from you. And I hope our students who will watch this podcast will also get motivated to study, and medical students will achieve their goals and become something more than they are now. You both of you mentioned that there's not always chances where a doctor can help a patient, right? There might be cases where like it's the end of the road, and with your brain understands that you can't do nothing. It's like it's the end. In these cases, how do you deal with this, or how do you tell the relatives, close people? How do you explain this to the patient? And have you ever felt that like the stress on yourself that, like, I have a patient, but I cannot do anything? How do you like deal with this?
So I'm going to come in from my angle. And unfortunately, Western medicine, has lost a lot of the spirituality aspect of when we deal with these, human tragedies or, these difficult life questions where we cannot help, and we know that we're all going to, die one day. That's a given. Some people early, some people late, some people peacefully, some people through, extraordinary hardships, some people through wars. There's so many ways, and I've struggled with that for a very long time myself, because again, they don't teach you in medical school how they can't show you and they can't teach you the empathy part, the humanity part.
I think it comes from a person.
That's true. And for us, ours, our religion actually does give you a lot of, ways to, kind of answer those things, because here, my aspect is, again, it's all about human suffering. We deal with people who suffer, correct? And, how do you alleviate the suffering? People get sick. We tried as a surgeon to do surgery to help that, alleviate that suffering. And a lot of times we can help and sometimes we can't. And when we can't, what can we also provide that can help it? And I find personally, the only thing I could do is, listen, we know that we're in this world to be challenged. We know that in this world, we're going to be tested. That's a part of it. And sometimes it's through, joy, and sometimes it's through sadness and through suffering and through ill health and through, our wealth and finances. Every aspect we're going to get challenged on. And I know that the Almighty God has a justice system in place. So for those who suffer a lot in this world, we do have another world, that we will be rewarded with. And I don't lecture this way to patients, but I try to, give them that hope to say, listen, a cancer patient that's dying, that, now there's really nothing else that we can, offer at this point. Let's try to ease your suffering and pain as best as we can, with whatever medicines that we can. But know that at the end of the day, when we do pass, we'll be compensated for this in a way, or this is the saddest one I used to encounter is with children.
Yeah.
You have children with brain tumors that you can't treat, and that there's nothing you're going to be able to do. And sometimes you even question God, saying, why would you do this to a child or so?
And I guess it's more difficult to explain to a child in a psychological way because...
Actually, to be honest with you, children are extraordinarily resilient. It's not them that actually question and, they react. Yes, when they're in pain, they react or whatnot. But, I think they're more stronger than adults.
Adults, sometimes.
Dealing with these issues. It's, it's the parents. Because, if you're a parent and you're seeing your child suffer...
And you can't do anything.
Your doctors can't do anything or so. Just imagine, what that would... I have children too. I can't even imagine if that was... Yeah. But, there was a hadith saying that, kind of comforted me, and that hadith actually said that, and I'm going to paraphrase, I don't want to kind of miscommunicate, but the paraphrase was basically... when their parents would ask, Allah, why did you do this to my child? Or, why did he have to suffer? He'll ask the child, did you suffer? And the child would say, I never suffered. He didn't even remember the suffering. So that time of suffering was like so brief and in an eternity of time.
I guess it was more painful for the parents than...
It was for the pain, yeah, because they're seeing their own child suffer.
Of course,
so. But these are life's tests.
Yeah,
and the best thing you could do, we live in a multicultural, religious aspect. But take what I have learned from my religion and put it in a way, that gives some people some meaning. And it's really important because physical treatment is one thing, but the spiritual treatment. I think, we're better doctors if we offer people some comfort in that spiritual realm as well or so. So, a lot of the, I just was in, Samarkand and Bukhara, and, these are the seats of the great learners, who were not just, scientists and philosophers, but they were philosophers as well, and both spiritual. And that's how they, were able to ignite a lot of, the Renaissance and scientific endeavors, is because they used to, take the religious and the philosophical and the scientific and the material world and amalgamate them together. And that's why they, grew to that extent. And I think it's important for us to, again, not be, I've seen doctors who don't do that, and they may be great surgeons, but they're not great human beings.
Yeah.
They didn't really provide their patients the humanity.
Yeah.
I mean, literally, I've seen doctors come in, I'm sorry, Mr. So-and-so, you have a, and then they walk out. I mean, is that the type of, culture, or is that the type of, physician or behavior that you want to foster? When you're ill and you don't, you're scared, you don't know what's going to happen, you may be suffering or so, you need some healing words as well. You need some healing thoughts as well. You need some, some of that to allay some of that anxiety or so. And I'm not saying all, there are some people that do have a good, I've learned, I've, at the end of the day, also learned from good teachers too, or so. And I've learned from people who take a few moments to try to give that kind of solace or so. Mm-hmm. But that's very important, I think, is to, as physicians, not just, focus on the science of what we're doing and the protocols of, the best treatment endeavors, but also to make sure that we also take care of the humanity part as well.
I guess it's really important because when you have a patient and you're a doctor, right? And when you enter their room, they see you as not a doctor. They see you as the last human being who will save them.
That's true.
Yeah, who's able to save them. So I guess they understand that everything, their lives is in your hands. So when you just tell them that, I'm sorry, but you're gonna die, I guess they get this like kind of disappointment.
Right. Yeah. Yeah. Like I said, one of the statements I typically say is, and these are, just before coming in here, I had a young gentleman, and and he had a malignant brain tumor. Came in with a new seizure. Never knew that something was wrong. And that's one of life lessons too. You never know what's going to hit you.
So he didn't have any symptoms?
No symptoms, and he just developed a seizure, a new onset seizure attack. And that's why they brought him to the hospital. Before that, totally healthy. I think he was like 28 or so. Big malignant brain tumor.
Did he survive?
Well, we did a biopsy. From all the investigation, I could tell it was a malignant brain tumor. And then I did a brain biopsy, and yes, we confirmed it was a malignant brain tumor or so. And we give them the statistics. Listen, we can do surgery, we'll extend your life. But at the end of the day, the likelihood you surviving past 5 years is less than 10%. So what does that mean to you? Or what does that mean to somebody else? And of course, they're in that shock kind of state, and lots of questions
because
arise.
we didn't have any symptoms, and unexpectedly,
Exactly. But, one thing that also I learned and I appreciate in my, is that every day I see people whose lives were absolutely normal, maybe very happy, they had ambitions and whatnot, and something strikes. And their whole world is just totally changed.
Collapse.
I see this almost every day. And it just goes to show, how sometimes ungrateful, we are to take a step back and say, wow, the family that I have, the health that I have, the, whatever material needs, even though they may not be as much, how grateful is this, to us? I learned from this. But also, you can tell them they have a new perspective. But at the same time, I also tell them, listen, I have no guarantee I'm going to get home. I'm going to get out of the hospital. I'm going to start driving home.
Get in a car accident.
And you never know if I even, So, these are thoughts that you go through. Yes, you got diagnosed with a brain tumor or so. But is there any guarantee any of us are going to be alive the next day? No. So what I do find is, and I actually see them later as well, they are a lot much more, as there are some that obviously do get depressed and get very bitter or so, but there are others that, get a certain level of peace, and because now they've looked at their lives in a very different manner. or so.
I guess you start appreciating your life after.
Absolutely.
Reassessment.
So, I can tell you, me personally, every morning I go to work, alhamdulillah, that's all I say. Thank goodness for what I have. And every evening I go back, and sometimes it's very late. Alhamdulillah, I have everything that I'm going back to my family. I'm going back to my home. I have my health, because you don't know. I mean, so many stories I can tell you. I had about 2 months ago, I have to tell you this story.
Okay, I'm listening.
Yeah. She was actually a model, a magazine model, driving on the freeway, when there was a truck that had a airplane piece of equipment. It got loosed and went right through her window shield, and took half of her face with a bad brain injury.
The propeller.
Yeah. Would you ever think
Prop.
that she was just driving to work?
Prop injury.
Yeah. What kind of day she had planned when this big piece just flew off and took half her face?
Including brain.
Including brain. She had a frontal brain injury, so I had to reconstruct her cranium, and she ended up, I followed her for about, 2 or 3 months. But in that 2-3 months, she underwent 19 surgeries, lost her right eye.
At least she tried, and she fights.
No, she'll get back. Very remarkably. She's done very well. She's only 24.
So young.
But yeah, would she ever have thought that she was going to go to work one day and something like this happens, and all of a sudden, and so I've tried to put the spirit in her. Says, listen, you will do okay. You'll get another chance. But this may be a sign from maybe God to tell you, listen, I have, you have plans, but he has plans, and he may have a better plan for you. Maybe this event that happened to you could teach other people, other young people that are in depression, because, depression is a huge problem in the United States. Drugs, that leads to drugs and to a lot of these other problems, alcoholism and whatnot or so. So there's a lot of stress in society over there that young people deal with, and maybe these are things that, you are become an example to others to say, listen, I was having this world all of a sudden changed on me, but there must be some purpose to this. And how do you benefit the next person, to say, this could happen to you. Look what happened to me.
Yeah.
I guess this moments led you to look at your life from a third point of view.
Yes.
From the side, you sit there and you get the chance to look at your life from a side, and you get to analyze everything.
Absolutely. Right. So I know I would like to talk much more about the sciences and whatnot, but it is important to know that at the end of the day, we deal with human emotions and, and health, not just being the physical health, but mental health, and all these things are put together. But we deal with extraordinarily difficult problems or so, and we do the best we can. And sometimes, yes, it's extraordinarily rewarding when, I treat the patients coming in who are dying of a brain aneurysm or a stroke or a traumatic brain injury, and I'm able to fix them and they get away with it. And, and that's also very rewarding, because people actually find that they have a new meaning. They nearly died. They nearly were neurologically devastated, and we were able to help them. And that's one of the things I usually tell my patients is, listen, we gave you the chance. Make sure you take good advantage of it.
Yep.
And there's a certain level of, satisfaction and just, not just from their families and the patients themselves, but we get in knowing that, we directly affected a person's life who, otherwise could have gone very, very wrong. So yes, there's a lot that we help, and there's a lot that sometimes we can help, but that doesn't mean we continually to try to, treat them, whether that's mentally and physically and spiritually, to get them to get more meaning out of this.
That's really inspiring again. I have this question, before going into surgery, if it's a really difficult surgery, right? And obviously before entering the room, you don't know if at the end it's going to be a positive outcome or a negative one. Do you ever feel like scared?
Oh, yeah, absolutely.
What, like, what do you do at this moment?
Right.
You can't
Well,
just say...
and that's what time and learning, that's why neurosurgery, the field itself, is so rigorous and so lengthy, because you may be the smartest person and you can, you may have the capacity to absorb large amounts of information and, regurgitate it and, know all the anatomical tracks and all the, names for disorders and, brilliant mind. But there's a certain level of wisdom that goes into knowing how to treat, what to treat, at what time to treat, and, the complexity of things, and to plan things out in your mind. So every time I have a surgery, let's say a brain tumor, I'm continually the day before planning, okay, how am I going to do this? What potential complications could I have? What if I go through this pathway or that pathway? Or, what complications could I, get while going through those individual pathways or so. There's so much that goes on. I mean, it requires a lot of good preparation in order to make sure that surgery goes well with the least a bit of complications, as smoothly as possible. And not always, complications are going to happen. That's part of human life. I keep telling patients, if you come across a surgeon that says, I've never had complications, run away, because that's totally false. We always have complications. That's a part of, of the experience. But it's more important to know how we deal with those complications and, how to minimize the, those complications as well. So there's a lot that gets processed that only time and wisdom and learning, continuing learning. That's why it's important that we always get what we call continuous medical education or so. We're always required to have a certain number of hours of relearning. So we go to, other conferences and CMEs and, go through other courses to make sure we know what's, we learn from the teachers. There's one that I value the most at one of the annual meetings is, the master surgeons and what their complications are. Because anybody maybe can do a good case successfully, but what do they do when those bad complications occur and when they're, all of a sudden they hit a vessel and it's gushing out, and it's important not to, panic and, how to devise a way so that you can control that bleeding so that patient doesn't die, on the table or so. So there are many things that we learn from others as well, but it is something that sometimes, you cannot get until you have went through enough time and enough learning, enough skills that has been imparted to you to make sure that you have good outcomes on a continual basis. So I take it as have to humble myself, because as much as you think that you've done and seen and learned, there's always other things that you've not seen. And you learn from that as well. So, so there is a certain level of humbleness you have to have, because again, the master surgeons don't become masters at young age. They become masters over a long period of time after seeing thousands of cases and, many complications, and we all have our different experiences as well or so. So that's the reason neurosurgery is so rigorous. It needs to be rigorous. Unless you have been put through the grueling quote, we have a special forces in the Navy that, they go through extreme physical endurance tests and, and literally they're sleep deprived, they're almost hungry, but they have to go through this in order to become better soldiers. The same thing with neurosurgeons. You have to get through the hours and hours and sometimes sleep deprived moments and, continually, getting these complicated cases. And, that's what you need to do in order to, become the surgeon, because, would you not want, God forbid, if you had a family member or yourself and, needed your brain surgery on, that you know that brain surgeon has gone through enormously tested trials and and training and everything that they has in order to get a good result. Yes, so sometimes some certain fields need to be rigorous, and as complex as the machinery of the human brain is, that's what it takes in order to try to master the surgery of it or the treatment of it or so. And let me tell you this, there's still a lot we don't know, and there's still a lot we haven't figured out. And that's what's so cool about neurosurgery as well, is that time still gives us the ability to learn more, find more, and devise more ways to get better results.
I guess it relates to generally in medicine, because there's a lot that nowadays doctors don't know still about people and human beings. And every day something new comes up, and from this, I think the more you do, the more you learn.
Yeah, absolutely.
Do you have a special ritual?
Ritual. Well, I'd like to pray before surgery, for patient to good outcome, specifically in complicated patients and kids, and pediatric, patient population. I'd like to pray, and with the name of Allah, we'll go and start with Bismillah, and hopefully all cases like complex cases or complicated cases should go well. Yeah, again, we just providers, we're not gods. We're not there as a magician and try to fix. We're just providers and try to help them to go through, try to fix them somehow to get their lifestyle to semi-normal. It's not going to be back to normal 100%. Everybody knows that, specifically if it's trauma, or motor vehicle accidents, or God forbid, like gunshot, that kind of procedures, because we're dealing with that emergency cases too, or people in the street shooting to each other. It was two friends. One of the case, it's interesting actually. There are two buddies went to casino, and they drink a little bit more probably, and they shoot each other at the end. And they didn't die on the spot. So, and both of them got hospitalized to our hospital, and we operated in both of them. So, and one of them ended up and died, but we able to survive at least one. So, and when that guy realized that he shot his best friend, he was more upset, and he's alive now, and his body's gone. So that kind of cases happens a lot, and unfortunately, and I always ask myself, why? Exactly. Why are you doing this? You have everything. You have family. You have job. Your life is, fulfilled. And why you have to go through this? I don't know. So that's the back to the question about the ritual or some kind of special, and this frustrates me more. I'd say, this kind of cases in a young age too. They have like whole life ahead of their, but they cannot utilize that time, efforts, and everything in the right manner. And it's sad.
It's quite sad, yeah, because
yeah.
Well, you never know. Maybe you should take a look from their perspective at the situation, because you don't know what was going on there.
True.
So we can judge, I guess.
Yeah. I'm not judging. I'm just asking myself question: why people doing that? Why? I have no logical answer to this. It's just to me. I'm not judging them. I'm not asking them why you guys did this.
Yeah.
This is just my personal, thing. So, and another message, I would say, to people who is listening us or who is seeing us, specifically for medical students, right? I would say study well, and get as much information as possible and go abroad. Go abroad, seek knowledge somewhere else, and come back. For sure, come back to your own country because nobody will appreciate you like your own people. The knowledge, set of skills that you can provide for your own people, nobody will appreciate you like your own people, like your own, like if I'm from Uzbekistan, I'm willing to come back to Uzbekistan, at some point. Yeah, but I don't know when.
Especially if there's a need.
Yeah,
especially. There's one thing if, you live in an environment where there's already, a lot of specialists and, they're providing this cares. But when you go to somewhere where there actually is a real need, I think that's where, people like us can give the most impact.
Yeah.
Or so. Because you're now trying to bring in a knowledge base, a skill set to an environment that didn't have it before, where the need has always been there or so. But and on top of that, the biggest thing is to give it also to the next generation. And, the younger guys that are, guys and girls that are coming out and imparting that to them, because at the end of the day, you're living in that society, you're living in that country, and you're the one that's going to be able to help most impact, the health of, of your peoples.
Yeah, it's quite true. Like, as you know, in the last few years, technology has evolved a lot, and medicine and in general in the world. How do you think it impacted medicine and neurosurgery and everything that's working now?
Well, it is quite a big impact lately. Like I'd say, last decade or 15 years or so, it's been huge progress in traditional medicine. Some of the diseases can be cured without even surgeries now these days. Which is a huge progress. Huge. Even surgical procedures now these days, as I mentioned in the lectures, the old-fashioned way when we can make huge, big incision and put multiple instruments. Now everything, those kind of cases can be done minimally invasive, with the incisions as small as 2 to 3 millimeters to 1 centimeter, of incision, and instrumentation and decompression and all those. So it has been a huge impact for physicians specifically who trained and learned old-fashioned way, traditional way, But that's why we kind of physicians, and we have to keep being on top. We have to keep educating ourselves. That's the key point, actually, for all physicians. It doesn't matter you're a medical student or you're already a physician. You have to maintain your professional skill level up to date, let's say. If today's date, giving you this environment, you have to follow this. You cannot say, okay, I'm, old school physician, I can do only this way. I always eager to try, every time, specifically in the United States, the technology rapidly change, and they keep bringing new, techniques, new technology, new approaches. And I think everybody should have eager to learn everything new. It's not necessarily the best way, but at least this is new. You tried, and would you implement in your practice? Well, yes, sometimes you can say, yes, this is mine. I can do this with my patient. Or sometimes you can say, okay, let me still kind of observe and let me see how others do. Maybe it's not my time yet to use this kind of technique. So, but back to your questions about the new technologies and new learning skills, definitely you should take advantage. You should take advantage and you should learn new technique because in that case, you'd be comparing, old style, classic way with the new style, and then you can make your own judgment and assessment which way should benefit the patient first. You have to always put the patient first. So patient care is supposed to be always number one priority, right?
Yeah, absolutely. Yeah. So I actually totally agree with you. Just because we have more ways of doing things doesn't necessarily mean there are better ways of doing things. And I think that's what we have to grapple. And especially in the United States where, yes, we do have the most advanced treatments in the world, but it's also the most expensive. And there are certainly people that can afford it. And also, we're also having a situation where some people are being financially ruined because of their health. And that puts a dilemma on the system as well, because somebody's got to pay for all this new technology and new ways of doing things and the new drugs. And so there has to be a cost benefit analysis that, we've been forced as doctors to then sometimes use. So, new and all these new gadgets and all these things doesn't necessarily mean better or so. Yes, at certain times it does. But at other times, traditional methods are also, just as good. And I'll give you the example of back pain.
Right.
A lot of critiques of the U.S. healthcare system is saying we do way too much back surgeries.
Too much.
And at the same time, we're not getting better results than in Europe or other places that have traditional ways of treating, back pain and, back problems or so. And mind you, again, it's a very, patient by patient basis. That's what's important is what's best for the patient, and that's where, again, going back to your training as a physician to know anatomy, to know physiology, to know pathology, to know all these things, to know, why is the person having this problem and can the treatment that is specifically targeted to that, the best for them or so. And that's where, and this is another, cool thing about AI is AI can potentially help bring that kind of decision-making a little bit more, specific to each patient's problem or so. Again, a new technology that can then, maybe help determine, what best pathway, conservative versus surgical versus, any other that may actually help that patient outcome, knowing a huge database of patients with similar problems and how they do. So these are very important. But at the end of the day, you still need to be a good doctor. You still need to be, because you're the one that is directing that care. And it's really important for you to, know what the source of that problem is based on the knowledge you gain in medical school and beyond or so. But not necessarily, you can't have an instrument and look problems for the instrument. You need to have the problem and what's the best way to treat the problem is. So patient-centric should always be, the goal.
It's quite interesting because, yeah, you're right. Because at the end of the day, no matter how good the instrument is, you're the one using it.
Yeah, that's correct.
So whatever you do, it depends on you.
Correct.
What would you recommend for medical students or students who are planning to study medicine? How should they, because it's a really difficult pathway, and not all students come to the end of this pathway, because some students might come to the middle and say, you know what, that's it. I'm tired of this. I'm not going to do it. Not my thing. So what would you recommend to students to actually reach the end and achieve what you guys have achieved?
For me, I would say that in medical school, especially, you get opportunities to go through each specialty, and just there's a reason why you have those rotations, and going through pediatrics and OB-GYN and internal medicine and cardiology and surgery. All these are there so that you can get an idea of what piques your interest. And I tell everybody, you have to have a field where, choose a subspecialty or choose a specialty where you can wake up every morning and be eager to go to work. Because if you choose a pathway or a field that, you struggle to get up and you struggle to, go to work and you're not motivated, you're not going to be a good doctor. You're not going to be happy in that. And although you may still, benefit patients or so, but that's not going to give you fulfillment. So it's really important to really go out there. And there's so many resources now to, whether it's online or, in the different hospitals, or even shadow maybe a doctor that you admire, you hear about from your family, you hear about in the community, that there's a specific doctor. And I would say, and this is another thing I try to, tell the young ones is, don't ever get intimidated by going out to knock on doors or contact them in some other way to introduce yourself and say, here, I'm a medical student and I really, interested in your field, and may I shadow you just to see that. I get that all the time, as a matter of fact, and I encourage that. And I think those are the people that actually not only will become more successful, but really are very resourceful. Right. They're not afraid to go out there and ask. And by the way, if you do come across somebody that doesn't have the decency or the humanity to give you a good word or whatnot, go on. That's not for you. You'll find somebody else that will. So yes, continue seeking, open the doors for yourself. Don't let, sometimes opportunities come to you, but I say go out and, seek it out. And, it doesn't matter if we're 20 hours we work, but, if I get a text or a request from somebody to say, I'm really, really interested in neurosurgery, may I please come in to your office or, have just a round for you. And I'm always happy to do that or so, because, what I want to do is make sure that they know what they're getting into. And so, and I try to give them as, fair and open and honest, insight. And I tell them, sometimes I barely sleep 3-4 hours. Right. So if you're somebody like that, likes your sleep, this may not be for you. So, and there are some people that, love medicine, but don't like the human interaction. Right. That doesn't mean that, there are fields in medicine that actually don't deal with a lot, like radiologists, or pathologists or so. And you could be a very good, pathologist and radiologist and not have to deal with, everybody's different and everybody has their unique skill set. You would do best if you know, number one, honestly and insightfully, I'm a people person. I'm not a people person. Yes, I like, interacting with and comforting people and whatnot. And, that there are specific groups of specialties, pediatrics and, medicine and, cancer, hematology, oncology. There's a lot of, subspecialties now that do well most, and you'll be the best doctor if you have that knack for being able to deal with patients in those kind of difficult situations. But if you're not, absolutely, there's even healthcare administration, and there's also the business of medicine that I think more doctors should be involved in, because at the same end of the day, somebody has to pay for these kind of treatments. Right. And if it's only that if you're a doctor, you have the insight to know whether these certain sets of technologies or treatments or services are going to be beneficial to your population and to your community or not. So that's the cool thing about medicine, is that you can gravitate into so many different ways. But it does take some resourcefulness on your part, on all the medical students, to kind of find a pathway that, would be that they think that they would excel at. Hope that answers.
Yeah, you pre-answered my question, but still at the end, it's pretty difficult to choose a pathway, because when you start these medical rotations, you see different cases, you see different patients, different doctors, different treatment, and you sit there and like, boom, you have a brain explosion.
Your mind is going to be blown. But for me, I would say there is a great quote by Genghis Khan. He says, if you're afraid, don't do it. If you do it, don't be afraid.
Yeah.
It's like you have to determine to yourself, number one, this is yours or not. That's the key point, I think. If you choose this path as yours, then you have to proceed till the end and be successful in it. Be the best and only the best. In that case, you don't have to be worried about money. You don't have to be worried about glory and stuff like that. You just do your job at the highest level possible, and then you'd be the best. You'd be the one.
Yeah, and by the way, when we say success, to me, and everybody's success is different. To me, success is, number one, looking at yourself and saying, okay, I've accomplished some of what I want or so. Nobody's ever going to accomplish everything, right?
That's true.
But some of what you want. I mean, this is an accomplishment itself. Graduating with a medical degree is a big accomplishment. You're a doctor.
Yeah.
So it is an accomplishment. And so long as, you work as hard as you can, and again, hard for that specific task that you want to do or so. But at the end of the day, your community will tell you if you're a good doctor or not. You'll find out. And if you can say that, listen, people say this is a good doctor, that's success. There's no other way to kind of put that in there, because I've seen, let's say, some people are motivated by the financial factor, but they're not always the happiest either. And not only that, but they not necessarily are the most respected. So there's different, ways to, to garner what it is to be successful. But I'd say, as long as your heart says, okay, I'm so thankful what I have. I have accomplished this. I got a medical degree. I'm a doctor. And you do you're involved in the daily business of caring for patients, and you've done your best, and you got acknowledged for that. And like I said, you'll get acknowledged. Don't worry. People will tell you if you're a good doctor or not.
Definitely.
Yeah. Not only by words, but just by actions, just by appreciations or so,
Yeah, there's this quote that my parents usually tell me that, like, money cannot buy happiness. Money can buy comfort.
Right. Absolutely.
So I always like this. I remember this, so I try not to run. Yes, financial part of the job is quite important, because you have your own family, you have your own kids, responsibilities that needs to be paid, right? But you need to also look at the other side of your profession. So if you have money, you have comfort, but that doesn't mean that you have happiness.
Right.
So I guess...
Yeah, you have to find these balances.
Yeah,
and,
both.
Exactly. And your heart can only tell you what's balanced for you. And, that's general, challenges that we deal with in daily life ourselves, that self-restraint to also say, oh, listen, I better not do that just for the money aspect, do that extra case that I may not really need to do, or, impose, some extra work or extra financial burden on somebody that, because like I said, when you're making a decision about recommending treatment to patients, sometimes sometimes you have to choose, can this patient afford this drug? Maybe there'll be an alternative, cheaper drug that they can use, or you recommended a certain surgery, but maybe they don't need that complicated surgery. Maybe they can use a smaller surgery. I mean, these are all things that we always deal with, and it's important. I mean, these days, these financial considerations are important because some patients can't afford it, or some patients are burdened by it, or so. So sometimes you don't have an option, and of course, you have to, again, what's best for the patient, or so. But it's also important to reflect on those things, not only for yourself, but for your patients as well.
Yeah, it's true, but unfortunately, not all doctors and not medical centers actually follow these rules.
That's correct, but that doesn't mean that that's why I'm saying, if you're able to get above and beyond that, and make that point, that this is what would be best for you. Believe me, you'll always be recognized for it. That that decision was made, in their best interest, or so. I have one saying that I often tell patients: if you were my sister, or if you were my brother, or if you were my father or mother, this is what I would recommend. And I continually use that paradigm to make decisions too, because like I said, there's sometimes more than one way to do it. But when I'm there, I sometimes patients, listen, if you were my sister, this is what I would do. And that gives, I think, a certain level of comfort to patients.
Comfort and competency.
Yeah, exactly. Knowing that, yes, this doctor did provide, the best answer for me. At least he showed it in his part.
Yeah, because they might go, because you don't know if might be that you're not the only doctor they went to. So they might collect like different, perspectives, different solutions to the problem. And then since you don't have this medical degree, so you don't understand what is going on exactly. So I guess it's quite difficult to choose the right.
Right. Yeah, and that's actually a good point. That's another thing I always read. Never be intimidated by, or how, especially in cultures like over here, some doctors actually will get a little offended if patients say, well, that doctor recommended this. But I would encourage it. I said, okay, that's my opinion. That's his opinion. And sometimes there's more than one way to do some things. So I would give it to them to say both are acceptable. You make your best choice. And that doesn't have to be anything offensive, because sometimes there are more than one way to treat.
Yeah.
Yeah, so I guess you just need to, again, it's teamwork.
Teamwork,
Teamwork, and have good honesty, and always tell, because again, one of the advantages I am saying always is that at the end of the day, I'm accountable for myself, and that's honestly another thing that really truly gets me motivated or whatnot is at the end of the day, and especially our field is such, we get called at 2 a.m. at the most, difficult times.
Yeah.
And sometimes you will sometimes say to yourself, oh, okay, I'll treat this later, when the patient is going to be neurologically harmed if you wait on him. At the end of the day, who's going to be accountable? When you're in front of your God, you think that the money you earned is going to be accounted for? No. It doesn't matter whether you're a billionaire, trillionaire, or whatnot. The question will be given to you is, when that person came to you and needed your help, where were you? How did you respond? Because you're going to give that answer. Nobody else is going to give that answer. So I continually, in that 2 o'clock in the morning, I said, oh, pada, I'm going to be accountable one day. So yes, I get up, I get out, and I do what I can, or so. Because at the end of the day, I am accountable for myself.
You're responsible for your actions.
Absolutely.
Words.
And then you're the one who is going to be answering for your actions.
Exactly, not your money.
Absolutely.
Not your money,
Absolutely.
yeah. And another thing which I'd like to mention for, future doctors, medical students, and so whoever is listening to us, be respectful. Yeah, be respectful specifically for your own colleagues, because as Dr. Shah mentioned, everybody has their own opinion and everybody has their own approach kind of to fix certain problems. If he thinks this way, and I think differently, it doesn't matter if he is a better doctor than me or I'm a better doctor than him, but be respectful to your own, right? And tell the patient the truth always. Don't lie, and don't try to give them some kind of like untrue or unreasonable expectations. Because some of the patients come and it doesn't matter we're from United States, from anywhere from like the world or Moscow or it doesn't matter. It matters how you see this problem, right? And how you present this treatment plan to the patient, and how patient feels about this plan. And then when patient says, "Oh, this physician or this doctor, I went to Turkey, I went to Germany, and this guy's saying totally different." Yes, that's his opinion. This is my opinion, and I respect his opinion. That's why you come to me and ask my opinion. I'm giving you my opinion. Now it's totally up to you which way you want to choose. So. And I even in the United States, doctors, when patients coming from one physician to another one for a second opinion, third opinion, doctors like trying to badmouth, their own colleagues, right?
Yeah, it does happen.
It does, unfortunately, it does happen. And I think my message is try to be professional, try to stay professional and respect somebody else's opinion. It's not necessarily like as I'm telling you, my opinion is my opinion. I see to cure this problem this way. He might see it differently, and Dr. Shah might see it differently. It doesn't matter. He is a better doctor or a worse doctor, and the same vice versa, right? But don't badmouth, specifically your own people. Like doctors supposed to support doctors, and when you become doctor, it means God's willing for you to become a doctor, and you have to help, right? So that's why we have to be respectful and professional to each other.
Yeah, and the last thing I would say, if there is a last at this moment, smile. There's a sunnah in smiling. It does change the atmosphere. So I'm actually known as one of the happiest physicians. People are continually asking, Dr. Shah, how do you keep so happy? And I said, and it does spread throughout your team. When you go in there, you're smiling, you're lighthearted and whatnot. And believe me, it's difficult because you just got out of a 10-hour surgery and you're tired or whatnot, but still smile. And honestly, that does impact. It gives this aura around that comforts people, makes them better people, and even the patients, and makes their attitude a little better or so. So I don't think we smile enough either. So
yeah.
Well, I guess it's quite difficult to always keep up, but you have to, because you don't know, maybe your patient just died on the table, right?
Yeah, well, there are contexts or so.
Yeah.
But even if the patient that, has a bad, diagnosis or knows about it, when you come in and just with a gentle smile, I think that would give a little bit of comfort too or so. So, and these are studies that actually have been done, psychological studies or so, where, people who do give a sense of, happiness or, some joy or some smiling, it feeds off, it becomes infectious or so. And it does change people's,
perception
and, their attitude. These are real responses that actually happen.
And it's a real working thing.
Yeah.
If you walk into the room, smile, that's, you're going to be ahead of the game.
Yeah. Try it.
I will. Yeah, I hope our students will try it too after listening.
Absolutely.
You'll just get a department of smiling doctors.
I think that's a great thing.
Yeah.
Yeah, because, life is hard and we know everything is hard or so. But sometimes it leaves a little bit of a positive uplift to, to encourage everybody. Hey, life goes on and, this is a difficult task, but there are better moments to come. Remember, another these, or it's actually in Quran, with hardship comes ease. So as difficult as things may become, at some point, they also get better.
Yeah, very well said, actually. I want to come back to your saying that you mentioned that always say the truth to the patient. What if we say it from the psychological way that it's not always a good thing to say the truth? Because it might affect
for cancer patients.
Yeah, for difficult patients, you can't there should be a special way you say it. You say the truth. Because if you just go to the patient and say, "Oh, listen, in 2-3 days, you're gonna die. I don't know when you're gonna die, but you're gonna die."
Right.
You don't know how it might affect them. What if they're gonna be side effects of this?
Right.
So in this case, should you say the truth, or should you find another way?
Well,
to say
basically you have to always with the difficult patients, right? You have to think twice before you say something, specifically with them, because they're psychologically damaged big time because of their illness, right? So, and you still entitled in a position to deliver the message, right? Even though it's unpleasant message, but you have to pick your moment. I think you have to pick your moment when you're delivering this message.
Yeah, there's a certain way of delivering, that message. Now in the United States, where medical ethics is, taught very seriously, or so, patients have a right to know what's happening to them. And by even legal means, we can't withhold important information from them, or so. So we do have to be honest about that now. But there's a way to help it, and we do have people that come in. Please don't tell my mother she has brain cancer. And then we have to deal with them, and that doesn't mean that we just bypass them and say, "Oh, I'm sorry, I'm just going to tell her because I'm required by law." There's a certain tact to deal with it. And, and we're saying, okay, we'll give you the opportunity to disclose it to her, but you're going to have to disclose at some point. It doesn't mean that, you tell her, hey, you got brain cancer and you're going to die. I mean, that there's a certain way, as opposed to saying, we're dealing with brain cancer and we're going to try to do the best. And, life is in God's hands, but, we'll try our best and see what happens or so. And whatever treatment that we'll offer, because there are some patients that wouldn't want to go through the torment of chemotherapy and radiation, because sometimes these treatments are difficult, and we have to give the respect, but be honest about their diagnoses and about their problems. But there's a certain way to deliver it in a way that's also honest. And like I said, doesn't mean that we just come up and say, "I'm sorry, Miss So-and-so, and you have brain cancer," and just walk out the door. That's not a humane way to deliver these messages, but there are humane ways, and that's a challenge. But yes, there are ways to do it, and we should do that. And if the families don't want it, of course, we tell the family that she has to know, or he has to know. They have the right to know what their diagnoses are. But we could certainly work together to sometimes the family wants to deliver that message, and sometimes they want the doctor to deliver that message. But even as doctors, we should be empathetic and deliver it in a humane manner. And there's ways to.
I guess it depends on the doctor again.
Again, yes, true. Nothing's easy. Everything's yeah. But if it's very interesting, because in the United States, one of the single most biggest problems we deal with is malpractice. We have a lot of lawyers that would love to sue doctors because they generate a lot of money. And the single most biggest reasons doctors get sued is not necessarily for their professional ethics, but because either they were too rude to him, or they didn't, they just brushed them off and didn't communicate. Communication was the biggest issue, or so. So, and you can imagine, somebody comes to you and they, either don't talk to you or don't give you that level of respect or don't, and then just run off and you're bitter. And that bitterness goes, what was that? He just came in and just told me and left off, and, so they're bitter about it. So yeah, they're going to look for opportunities to, to get back at you, even though he may have, or she may have treated everything properly or whatnot, but they're still expensive. If somebody sues, it still has to go through, legal matters, attorneys still get paid. And, there's all these, it's a terrible system or so.
And it's quite expensive, actually.
Yeah.
Super expensive.
Absolutely. That adds a lot to the healthcare dollars because, again, somebody's paying for it, right? So, but the single most effective way to prevent that, and I've experienced that myself, is take a few minutes to sit down with the patients, explain to them in an honest way, even when complications do happen. And that's the important thing, is how you deliver that message or so. And you could save yourself a lot of grief, because if people know and they entrust you and, they got that respect back and they found that, Dr. Shah really came and spent some time with us and, even showed remorse and was, even said sorry about, I wish I could have done better or so. You're not liable to go and sue that person. You more or less, have you've created a certain level of connection there or so.
Connection.
So, and over, the rest of the world, maybe even if that's not the issue, but it's still an important way, how to garner, better respect and a better, patient friendly, environment.
Yeah. It's also like, do you think like medical students should have a separate lesson of psychology?
Absolutely. Absolutely. Behavioral science. We study behavioral science, remember? Yeah, behavioral science.
Study together?
No. Going through training, medical school and stuff like that, there is a subject, behavioral science.
That and the other one, believe it or not, I usually tell is, get a small book on philosophy.
Philosophy too, yeah.
Because on philosophy, there's a lot of things in philosophy. I mean, ethics is covered by philosophy. The
bedside manner,
all these issues that you grapple with are philosophical based issues, and if you understand the basis upon them, you can understand how to conduct yourself based on those issues. And it is a really deep subject that and you can find small books on it. And the reason I found out is because I had sometimes the hospital will kind of cite you for something, and I think mine was that I didn't tell a patient within a timely manner their diagnosis, because we were having surgery and traumas and whatnot or so I forgot to call the patient, and then I got the patients complained that did surgery on our family and we never saw Dr. Shah, and there was a good reason for it, but then they left apparently, and they complained, and the hospital said they complained against you, so we want you to take a course in ethics. And I said, oh, okay. And I didn't think that that would be, something I would enjoy. But, we went to an ethics course, and, it was a, 2-3 hour course, but we went through and they gave us a little book on philosophy, and because ethics is a part of philosophy or so. That was very insightful. And I actually been using that, every time I'm, dealing with situations and matters and thinking, the ethics of, doing one thing or another. So I think, that should be a good part of your medical curriculum as well, because these things kind of help you grapple with these issues or so as well.
I guess it also comes by time, like when a doctor actually starts working, when you start working as a doctor and you get all this like cases, and when the responsibility to talk with the patients falls on you, I guess it just comes naturally if the person has it.
Right. Well, some people have it naturally, but some people have to develop it. I mean, I never had this, as a natural,
Doesn't seem like this
skill.
actually.
No, it wasn't actually. I mean, it's something that I had learned and started to, believe me or not, I was a little bit introverted when I was more younger. I'm much more extroverted now than I used to be or so. But it did come with, you can change some part of your personality or so. But it does take effort, right? So you have to continually, make that effort to change those habits or those ways.
Yeah, I guess you're right. But you seem like a really comfortable person.
Yeah,
Really
I'm
easygoing.
comfortable. I'm comfortable because I am grateful, and every opportunity that I have right now is just, as they say, putting on the cake or so. Because I'm content with, what I've accomplished and what I've achieved, and the reputation that I have. And I'm not saying that I've just done it. It's a continuing matter, but that's why I'm comfortable is because, I'm, I'm grateful for the opportunities that have been given to me, and I never kind of let that out of my sight or so. And again, a little bit of humbleness or so. And again, life's journey. I never expected to come here, and everybody was expecting, where are you going? And they couldn't even say Uzbekistan. I mean,
I'm sure they
and I'm
didn't,
talking doctors.
they didn't even know what.
Yeah,
it is.
and literally. But by the way, just visiting, these historical monuments, and here in Tashkent and in Samarkand and learning, in Bukhara. Literally, I got teary-eyed because I never even knew we had such rich history in the Islamic world.
This thing like expectation with reality.
Yeah.
Usually when you go abroad and you say, oh, hi, I'm from Uzbekistan, they expect something much lower, I would say. I guess you understand me, right?
Of course.
Yeah, and then when you bring them here and you say, hey, look.
And it's true. That's why I was telling Ali is that, we have to do a medical conference here. We have to bring people here and let them know.
Guest.
Yeah, and honestly, I think they will be blown away or so because, as much information is out there, there's still not a lot of knowledge about this part of the world or so. Asia has made great strides, but they're very dynamic populations or so. It's very exciting, the way they're kind of advancing even beyond the West now or so. But I think there's a lot, just as much potential here, and I'm talking about all of Central Asia, not just Uzbekistan, but the rest of Central Asia as well. So I think there's a lot that you guys have going for you. I mean, not only a young population set, you have the history to back up, what you can accomplish forward. I mean, you're talking about the first centers of learning, in civilization that the West took from here. These weren't, they think that we're trying to play catch up, and to some extent it is true, because of history. But, you have such a solid foundation upon which historically you guys can go. You should be absolutely proud of that or so.
Yeah.
And then, and that's what I'm saying, because, in that part of the world, we don't hear about these things. But to come here and see that, is very uplifting. And especially all those younger people around here that are, striving and are just as sophisticated and communicative and, and connected to the world. I think that's an awesome thing.
It is. It is awesome.
I guess you're really proud of your country now.
I've always been proud of my country. Always.
Like I said, it's one of that is that, you guys are going to make the future or so. And the more interconnected you are and collaborate, and, even in the medical field, that,
right.
That medical, we all are. I mean, in the United States, even now, Chinese ancient medicine is now part and parcel of university systems. UCI Health, the University of California, Irvine, just created a new campus specifically also dealing with,
Chinese
medicine or so. I mean, they're saying that, we may not have all the answers to it. And, they're taking, now, having said that, they are sponsored by very wealthy Chinese people, but that's good.
It is good.
They want to put those services and knowledge out there, and people have accepted that. And so all of this just goes to show is the more interconnected and the more collaboration is, that also is good for world peace as well. The more understanding there are, and the more interconnected and the more people they know each other, the less likely they are to be, fighting each other or so.
Right.
So I think it's a responsibility upon everybody, here, anywhere or so, to engage with the world, to engage with everybody, and show them your, what you have, and the culture that you're in. People respect that as well.
Yeah, it's quite right. Another question I want to ask you is, that, as you said before, it's better to go abroad and come back to your country.
Right.
Well, as a medical student, it's not that easy to make a transfer to abroad universities. Plus, it's actually costs super expensive. Because myself, I wanted to transfer. Well, I was planning to transfer to United States, but I guess I realized that it's quite impossible to do it because it's expensive, it's difficult to reach from this point, and it takes a lot of time, and then I have to study beginning from the beginning. I can make a direct transfer.
Okay, so back to...
So how do you deal with this?
Okay, so how do you deal with this? So as I mentioned, my story. So I graduated medical school here in Uzbekistan, in Tashkent. And that was a kind of easy path for me to, accept this internship first and go through the rest of the studies and licensure and, residency fellowships and so on and so forth. But I guess my message is get your general medical education here and then refine your specific, set of skills. Like if you choose surgery, or if you choose OBGYN, or if you choose neurology, neurosurgery, if you choose geriatrics, if you choose any kind of specialty, I think you guys should go and explore abroad. You have general, base knowledge, right?
The 6 medical years.
6 medical years, exactly. Because see, my experience, I have kids, right? I have 3 kids. General education in the United States, it's not that great.
Really?
Yes. Well, this is answer to your question when people asking me where are you from when I said Uzbekistan. They say, oh, yeah, we know Pakistan. You're like, no, Uzbekistan. Oh, yeah, Uzbekistan. You're like, okay, there is no Pakistan. There is UZB. And they go like, okay, yeah, UZB. Why this happening? Because general education at school, they don't taught them geography. They don't taught them history. They never. Therefore, college and medical school is so
narrowed,
super narrow. Students pick and choose what they want to study. I'm not talking about medical school. I'm talking about college and general education wise, right? If we go back to the question with the medical school is ridiculously expensive and unnecessary expensive. And the set of knowledge they give you in medical school, just enough to pass USMLE. That's all. And being charged like close to $400,000 at the end.
Even more, I think.
No. My sister-in-law, she complete medical school.
In United States.
In United States. She's from Uzbekistan. And my brother-in-law, her husband, he complete medical school in United States. So combined debt back to medical school, close to $1 million.
At the end,
At the end, yes, it pays back. It pays back. But, by the time when you complete everything, you're close to 30, right? And then you start working. At 30, you should start family.
And you don't have, I guess, any expense.
You don't have funds. You don't have anything to support your family.
So it's like you need to start from the beginning, building foundation.
Exactly. And plus, you're negative. You're negative $500,000. It's always in the back of your mind. Oh, I have to pay specifically in like with the people with our kind of mentality base. That is big no for us in the Muslim world, right? Why you have that? Why you create that? Why? If education somewhere else is free, why you put yourself through this?
Or affordable.
Or much more affordable than in the United States. Why? Why you have to go to the United States? And I tell you what. So we did some studies, right, with the students from international students. They came from Lebanon, they came from China, they came from Singapore, Malaysia, and stuff like that. All of them pre-med students. They said, oh, I pray God to be accepted in the medical school. I go like, why?
We have to hear this thing here too.
In the United States, why? Tell me. So we go to the Google, we did the search. The best healthcare system, where?
You're asking me now?
Yes. Everybody thinks it's United States.
No,
it's
I
a mistake.
don't think.
No. The best healthcare system, 2023, was South Korea. United States was not even first 20.
I think it's just the picture that was created around
Exactly.
medical.
So where is the best education system in the world? United States, not even the first 15. Perception is bad thing. All people, whatever they have in their mind, it's perception. Created by media, created by somebody else. And remember, everything is better in your neighbor's yard. It's not necessarily, and it's not fact, but here in your mind, you always think, oh,
He's better.
he is better, or he has something better.
I need to have it as well.
No, I do agree with Ali. I think the best thing is complete your medical education. And there's many ways to go abroad and, under certain programs, do your residency, do your training, whatever you need to do to become a licensed physician, and then take, a year or two to see, and you can find programs, and again, that's where your resourcefulness comes at hand, to be resourceful. I mean, you can't expect everything to just kind of fall in lap, sometimes you have to do some hard work, but that's a skill that you should learn as well. Be skilled to find those resources where they have programs that maybe you could do for 6 months or a year or so, and they don't cost that much money, to just come in there, for example, do a series of rotations, or maybe do a fellowship or do a master's in, some
Healthcare administration.
Yeah. Or, there's a lot of things that you can do. There are PhD programs, master's programs, in the health-related sciences as well. So there's lots of ways you can do it depending on what you want to do, or even do a clinical rotation set, a mini fellowship. There are programs that offer that to international students as well, or so. Because again, they want to, encourage that, they want to have people come in and engage with them, and, so that they can show their health system, and then they go back. I think not to recreate their system, but to take the best from there and take the best from here and create something that actually would benefit, your societies.
I guess on a good note, I would like to sum up our podcast and come to an end of this podcast. I would like to thank you so much for coming today. I heard a lot of new things. I learned a lot of new things, and I hope our students who will be watching this will learn as well. Thank you so much for coming.
Well, it was an absolute pleasure. Appreciate your having us.
Thank you for having us.
Thank you. Dear students and who will be watching this podcast, please write down below in the comments who would you like to see in the next episode, and we'll try to invite this person. Thank you.